The nurse is caring for a client who is diagnosed with a terminal disease. The nurse should plan which appropriate interventions in the care of the client. Select all that apply. So, in our question here, who is the question being directed at? And here it would be the nurse. The nurse should plan. Okay. So, keywords in this one. So, nurse caring for a client who is diagnosed with a terminal disease. So, diagnose, terminal disease. Plan. Interventions. For care. Okay, now essentials. When we look at our essentials, any words here that are bold or should be bolded? And actually there is one. There's select all that apply. And yes, that is an essential, even though it wasn't on the list. And that is because it's a bolded word. Okay, so what's our question really asking? Patient has terminal disease. The nurse is making a plan for which interventions of care. All right. Plan for interventions. Plans for interventions. Select apply. Okay. We're going to go right down here. 1, 2, 3, 4, 5. Offer to contact the clergy to support the client's spiritual needs. Make referrals to other disciplines based on the client's stated needs. Plan to balance the client's needs for assistance with that for independence. Provide extremely thorough answers to each question asked by the client or family. Ask the client about goals for the treatment plan and how she or he can best be assisted in achieving these goals. Okay, so now we're going to change our option into a true or false statement, asking it to go with what our question is really asking. So 1, offer to contact the clergy to support the client's spiritual needs. True or false would be an intervention to help care for a patient with a terminal disease. So, in other words, is offering to contact the clergy to support the client's spiritual needs. Would that be an intervention? So, intervention to help care for client diagnosed with terminal disease. Pull it down here. So I'm going to say yes, because we would. Terminal disease, we want clergy. 2, make referrals to other disciplines based on the client's stated needs. True or false? That would be an intervention to help care for the client diagnosed with a terminal disease. Well, considering we want our patients to stay as independent as possible, that would definitely be something we would want to do, especially since there are things that we can't do as nurses, like physical therapy or occupational therapy. 3. Plan to balance the client's need for assistance with that for independence. True or false, that would be an intervention to help the client diagnosed with a terminal disease. That would be true as well. We want them to remain as independent as long as possible. However, we'll assist them with what they need to be assisted with. Get rid of this. Number 4, provide extremely thorough answers to each question asked by the client or family. True or false, that would be an intervention to help care for the client diagnosed with a terminal disease. Yes and no. I think we want to provide those answers throughout the course of the terminal disease, but I don't think that's necessarily an intervention that will help care for them. I think that's more in the knowledge. That's not necessarily caring for them. Number 5, ask the client about goals for the treatment plan and how she or he can best be assisted in achieving these goals. True or false, that is an intervention to help care for the client diagnosed with a terminal disease. That's an intervention to help care for anybody who needs a nursing care plan, because we always want to include our patient when creating or revising those care plans. So our answers would be 1, 2, 3, and 5. 3 and 5. And we are correct. And then it goes into the rationales.